blood pressure. Now we know that when the blood pressure is high, it's regarded as hypertension, right? Hypertension. Then when it is low, it's regarded as hypotension. So basically that one is just by the way. Now for hypertension, it's essential that we understand the stages of hypertension. Hypertension has stages. It has stages. Now the normal range of hypertension, there are five stages of hypertension. We have the normal stage. We have the elevated stage of hypertension. We have stage 1, stage 2, and the last one, hypertensive crisis. So these are the 5 stages of hypertension. 1, 2, 3, 4, 5. So these 5 stages, what does it tell? Is when you take somebody's blood pressure reading, the stage of it will tell you what to do. For instance, for a blood pressure to be normal, it should be less than 120. Okay, well, before that, we all know that this top one is known as systolic blood pressure, while the down one is known as the diastolic. So that one is, we all know that, diastolic reading. So any blood pressure reading that is less than 120, and you know blood pressure is measured in millimeter mercury. So this mmHg, millimeter mercury, basically that's the measurement for blood pressure, right? Then sorry, we didn't mention these things. For temperature, we know we use thermometer. It could be digital, manual. For pulse rates, we use what we call pulse oximeter. Then for blood pressure, we use a short form, we call it SPIG, but it's sphygmomanometer. So back to this. So any blood pressure that is less than 120/80 is normal. Now, but not as low as, now get this, if it is 120/80, it is normal, and less than 120/80, it is normal. But if it goes as low as below 90/50, that's, for instance, you have a reading that the systolic is reading 80, while the diastolic is reading 49 or even 89, this person is having hypotension. Now, the treatment of blood pressure is a very complex thing that we cover we have a separate lecture for that, about the medications and all that. So for the fact that it is not less than 90 or 50, it is normal. There are some people that you check their blood pressure and you see you are getting 170 and you say it's low. No, it's not low. It is normal. Or you have 110/75 and you say it's low. No, it is not low. It is normal. It's only when it goes below 90/50 that is regarded as hypotension. That is when it's low. Right? That is when it's low. So for normal stage of hypertension, it should be less than 120/80. Less than 120/80. Now for the elevated hypertension is this kind of hypertension that you get maybe due to stress. Maybe you stressed yourself and that. So that one is, it reads less than, the systolic will just be around 130 and still 80 for the diastolic. So that's the elevated stage. This one, most times, it doesn't require medication. Normal stage, elevated stage does not require medication, basically. So when you have stage 1 hypertension, it's just like the person is becoming pre-hypertensive per se. So stage 1 hypertension reads from anything less than 140/90. So if he has 130 something, 80 something, is regarded as stage 1 hypertension. Sometimes you can advise the patient also to use diet, maybe reducing sodium intake, increase fluid intake, and what have you. It can also be controlled, stage 1 hypertension. Now, stage 2 happens when the patient is having a blood pressure reading that is greater than 140/90. Now, stage 1 is within this range of 140/90, while stage 2 is above. When it's above 140/90, medication should be introduced. That's if the patient is not, if the patient is a BP patient. And also you should understand that if you have a patient who does not have any prior high blood pressure experience, it's advisable that you just give maybe a single therapy in the sense that if this person is having blood pressure for the first time, you can give a single medication. Maybe you choose to give amlodipine, right? Just amlodipine. It's when the person is having it for a very long time, or you can tell the cause of the hypertension, then you can do the combination therapy of giving amlodipine, lisinopril, vasopril, and what have you. So that's for stage 2 hypertension. Then this last one, hypertensive crisis. This one is regarded as a state of emergency that the person have to take hypertensive antihypertensive medication. So the hypertensive crisis is a reading that is greater than 180 systolic and 120 diastolic. So any reading that is this, the person needs to take medication for it. So that's basically about the vital signs that we'll cover for now. Then there's this other essential thing that we need to know as health practitioners. This one is weight. You know, sometimes people come to you and maybe you check the person's weight and the person has a weight of 100 kg, and the person will be like, it's too much, this one is too much. But now you have to understand that just like we have blood pressure, that the normal blood pressure is 120, less than 120/80, temperature is 36.5 to 37.5. Yeah. So when it comes to weight, there is no normal weight. There is no normal weight that, okay, if you're an adult, you must weigh 50 kg. Or if you're an adult, you must weigh 10 kg. Right? So how do you know if somebody has a normal weight, or somebody is overweight, or somebody is obese, or something like that? Now they check this thing using what they call BMI, body mass index. I know a majority of us know this, but we are just doing it for people who may not know. Body mass index, BMI, short form. BMI. So how is this thing is calculated? How is BMI calculated? For instance, if it's calculated by dividing the weight of the person with the height. Now the weight will be in kg, kilogram, while the height will be converted to meters. So for instance, let's say if a person has before we do this, let me give you the range, the BMI. This is what will tell you if somebody is overweight, underweight, or obese. So the BMI ranges, body mass index. Now we have less than 18.5. A patient who is less than 18.5 is regarded to be underweight. Now for someone who has from 18.5 to 24.9, which is basically 25. 24.9 has a normal weight. Well, for normal weight, there is a normal weight that they use for in terms of kg that they use for newborn. That one is called birth weight, right? That one is aside that. When you want to check a normal weight for an adult, this is how you do it. You check the weight of the person and the height. Then you divide it. If it falls within this range, it is normal. Then for someone who is overweight is somebody who, after checking his height and the weight, and the person is around 25 to something like 30, 25 to a range of 30, this person is overweight. That's only when you know if the person is actually overweight. So there are some people that will have a kg of 120, but when you check it with their height and it falls within this range, the person is not overweight. The person has a normal weight. Now, for people that have around 25 to 30, they are overweight. Then people that has greater than or equal to 30, these are people that are regarded as obesity. It's when your BMI is above 30. So this is the range. Obese. When your BMI is above 30, you are obese. So how do you check it? Let's say, for instance, somebody has a weight of 75, right? And your height, let's say 120 cm. Now, if the height is 120, I want to use cm because it is easier to convert to meter. So how do you just divide cm to get meter? You divide it by 100, right? So 100, this will give you 1.2 meters. So if you divide this 75 by 1.2, it will basically give you around, do the maths. Let me just check it. Or let's say 170, maybe okay. So 75 divided by 1.2. Sorry, hold on. Sorry. If well, let's just do it this way. 75. So if this person is having a person with this 75 kg, there's no way you have this height. Basically, there's no way you have this height. So with this, it's giving around 60 point something, which means the person is obese, basically. So that's that for the vital signs and pharmacokinetics and what have you. So we'll just go to the next one. We'll go to the next one, which is routes of drug administration.